Hi, my name is Jamie Means and I'm a student and a Division I women's basketball player, and today I'm partnering with Dr. Jason Hammond to bring some more clarity on some common misconceptions in the sports medicine world. So first up today we have the ACL in women versus men and why women are more prone to tearing it. So during my time as a high school athlete and now a college athlete, I've experienced so many of my friends and teammates like tearing their ACLs. But what is an ACL? So your ACL stands for anterior cruciate ligament, and it's going to run down the anterior part of your knee diagonally, and it's going to connect your femur to your tibia. So research shows that women are far more likely to tear their ACL than men in pretty much all sports. So why is this? So one reason that women are genetically predisposed to tearing their ACLs more is due to their hips. Their hips are going to be naturally wider, which is going to create a larger angle between the hip and the knee, and it's going to put more strain on that ligament. In addition to that, another reason why women are more susceptible to ACL injuries can be modeled through these blocks. For example, if this was the ACL, if the surrounding muscles of the ACL are not as strong, a small force can cause this to be, the whole thing to be unstable. Whereas if you have strong surrounding muscles, if this were the ACL, a small force is gonna not impact it quite as much as if the muscles aren't as strong. So it's really important to teach women to build up their quads, their hamstrings, so that not as much pressure is being put on that ligament. Dr. Hammond, are there any other explanations for this?
All right, fantastic job, Jamie. That was a great overview of the differences between male and female. One of the things that I do want to highlight is the way that you land. And that's what I work on with a lot of my female athletes, is making sure that they land appropriately. When you have an ACL injury, the knee goes internal, so the tibia bone goes in like this. And what happens is it rotates in and it goes forward, and that puts a lot of stress on an ACL. When it does that, it'll pop the ACL. And so for an example, when you land and your knee goes in like this, your foot goes in, not only does it put more stress on the ACL, but a lot of times it goes in and you have what we call a valgus moment, where the knee goes in like that. And when you do that, that increases your risk of an ACL tear. So what we recommend is when you land, have your feet either straight or a little out, and bend the knees and avoid this motion. Use those muscles to give it that muscle strength to take the stress off of those ligaments. So fantastic job, Jamie. We'll be back with some more later.